Okay, hello and welcome. My name is Meg Miller. I'm the outpatient physical therapist here. And today I'm going to be presenting on ways to manage high blood pressure. Before I start, I want to give a little brief introduction. I do these wellness seminars once a month on the second Tuesday of every month, and it's a different topic every time. And it's always available in the Ellingsworth Auditorium to come to live, or also available over the broadcast. And then they're also being recorded and then uploaded on the Residence app. So lots of ways to watch, and if you need to get handouts, they are available over in the Commons Fitness Center, or you can get a hold of me and I can get them to you. This week also, if you're watching live, or those of you that are here with me, there is also going to be another wellness event this week on Friday. The Fitness 101 will be available in the Commons. Gabe and Kira are putting that on, so look for details. I'm sure there's details on the Resident app about that, okay? Just wanted to plug that for them. All right, so today, ways to manage high blood pressure. This is definitely a very important topic, and also one that most people could benefit from hearing at least a little bit about. All right, so what is high blood pressure? High blood pressure, also referred to as HBP or hypertension, and hypertension is often abbreviated HTN, is when your blood pressure, or the force of blood flowing through your blood vessels, is consistently too high. So your blood pressure numbers, a lot of times we hear, okay, there's those two numbers and it's systolic and diastolic, and everybody goes, well, one of them's the top number and one of them's the bottom number, right? But let's talk a little bit more about what those numbers mean. So the best way to diagnose high blood pressure is to have your blood pressure measured. And today there's lots of really great ways to be able to do that. We have the automatic blood pressure readers, and then we have the old school type where you have to pump it up yourself and read it off the dial. And it's nice because there are lots of the automatic home options that you can do yourself, but then any healthcare professional that you're seeing can also take a blood pressure recording for you as well. So your blood pressure reading is recorded as two numbers. Your systolic blood pressure, which is the top number, indicates how much pressure your blood is exerting against your artery walls during heartbeats. Then the second number, your diastolic or bottom number, indicates how much pressure your blood is exerting against your artery walls when the heart is resting between the beats. So that's why your top number is higher than your bottom number. Okay, there's a little graphic there if you can see that. I know the print is small on it, but it says in the systolic phase, the heart contracts, blood pressure rises, and blood moves out along the vessels. And then the second one shows diastolic. In the diastolic phase, the heart relaxes and the blood pressure falls as blood fills the heart. So now let's talk a little bit about what we mean when we say healthy and unhealthy blood pressure ranges. So there's a chart in your handout that I can point you to for this one. The first handout is just a blood pressure log. That's just one example of a blood pressure log. That might be a helpful way for you to record your blood pressure if you're so interested. If that's not helpful, don't use it, but it's something for a reference in case it is helpful. But it's that last handout that has these categories. That one's going to give you a little bit more detail on what we consider normal, and then, as relevant to today's talk, what we consider to be high as well. Okay. So, and this chart that I'm referencing in the handout, this is from the American Heart Association and American Stroke Association. Okay, so it's also accessible on their website as well. So a diagnosis of high blood pressure must be confirmed with a medical professional. A doctor should also evaluate any unusual low blood pressure readings, which is why I give you that chart that you can track, because if you're concerned at all about your blood pressure, you need to review your numbers with your doctor so that they could have a good idea of what's going on. Because oftentimes we go into the doctor's office and we'll get one reading, and then we go back home and the reading could be very different. So it's most helpful to have something like that where you can track over time. That's going to give your doctor or your medical professional the most helpful information in engaging whether your blood pressure is at a healthy level or not. Okay, so this is that chart that I was talking about. So we'll just briefly look at this. So if we're looking at a normal blood pressure, your systolic or top number should be less than 120, and your diastolic should also be less than 80. So that 120 over 80, we hear that a lot. That is that cutoff between normal and elevated. So then if we look at the elevated category, your systolic 120 to 129 is considered elevated, and your diastolic still should be less than 80, even in an elevated. So when we talk about these categories, you see that little and in between for normal and elevated. You, in order to be in a normal or elevated category, your diastolic blood pressure, or the bottom number, still needs to be less than 80. If your diastolic is above 80, we're already bumping you up to this high blood pressure, the third category here, and that's hypertension stage 1. So hypertension stage 1, if we're looking at systolic, that top number is 130 to 139, or diastolic, that bottom number of 80 to 89. So those first two categories, you got to meet both. But to be stage 1 hypertension, you just need to meet one or the other of those. The same continues for hypertension stage 2, 140 or higher for systolic and 90 or higher for diastolic. Then that last category, which we hope to never have to see, but does mean that it's a medical emergency, is a hypertensive crisis. So a hypertensive crisis where you would want to consult your doctor or medical professional immediately, and most likely they're going to tell you to, if you don't already have a current plan of treatment, they're most likely going to tell you that you need emergent medical care at that point, is higher than 180 for systolic and or higher than 120 for diastolic. That is hypertensive crisis, and at that point, basically what we're saying by denoting that is that range where your body is in crisis and you're at very high risk of having a stroke or another heart or blood pressure related event, okay? So that's how we look at those basic categories there. All right, so this is a question that I get a lot. Which number is more important? There's not a clear-cut answer, but we'll go into some of the details here, okay? Typically, more attention is given to the systolic number, which is that top number, as a major risk factor for cardiovascular disease for people over 50. In most people, systolic blood pressure rises steadily with age due to the increasing stiffness of large arteries, long-term buildup of plaque, and increased incidence of cardiac and vascular disease. So what that means is there's more resistance when the heart is pumping the blood out. There's more resistance against that, and that increases that top number, that systolic number. So that's the biggest reason why systolic blood pressure tends to be the one that we focus on a little bit more, because we know that there are incremental changes in that for most people as we age. However, either, as we saw from that chart, either an elevated systolic or an elevated diastolic blood pressure reading may be used to make a diagnosis of high blood pressure. So the answer is they're both important, just for different specific reasons. According to recent studies, the risk of death from ischemic heart disease and stroke doubles with every 20 millimeters of mercury of systolic or 10 millimeters of mercury for diastolic increase among people from ages 40 to 89. So if you think about that, that's not a big change, right? Sometimes people will see, easily 20 to 30 millimeters of mercury change throughout the day with their blood pressure, specifically more often with the systolic. The diastolic doesn't change as frequently. Usually it's usually a little bit more steady, whereas the systolic can change with activity and with different things that we're doing. Okay, so high blood pressure is known as a silent killer because most of the time there are no obvious symptoms. Certain physical traits and lifestyle choices can put you at greater risk for high blood pressure. And when left untreated, the damage that high blood pressure does to your circulatory system is a significant contributing factor to heart attack, stroke, and other heart disease. So that's why I say, I gave you that chart that you can track your blood pressure. I don't want you to take away from this that you need to write down your blood pressure every hour of the day. That's not what we're going for here. But being that if you're not tracking your blood pressure, it would be very difficult to know if you had a problem because sometimes there aren't obvious symptoms. So it's always a good idea to just have an idea where things are. Be checking in maybe every once in a while, unless your doctor tells you to check in more often, okay? So some diseases that are specifically associated with high blood pressure. In most cases, the damage done by high blood pressure takes place over time. Left undetected or uncontrolled, high blood pressure can lead to heart attack. In a heart attack, high blood pressure damages arteries that can become blocked and prevent blood flow to the heart muscle. So high blood pressure, that blood having to use more force to get through those arteries over time can cause damage. And then as we talked about, blockages give more resistance, which make the heart have to beat harder and the blood have to rush more forcefully through those arteries, and that can contribute to damage that can lead to a heart attack. Then if we look at stroke, high blood pressure can cause blood vessels in the brain to clog more easily or even to burst. And then heart failure. The increased workload from high blood pressure over time can cause the heart to enlarge because it's a muscle. And so if it's trying to work harder, it can enlarge and fail to supply blood to the body, which is basically a very simplified explanation of what goes on in heart failure. And then kidney disease or failure. High blood pressure can damage the arteries around the kidneys or anywhere else in the body, but this is a common place that we see that. And that interferes with their ability to filter the blood effectively, which obviously is a very important task that those kidneys have. So as we can see, okay, we think of the heart first with high blood pressure because that's where everything's being controlled and mediated is at the heart. The heart is having to pump harder and work harder to get the blood where it needs to go. But as you can see, it affects everything else too. Some more secondary places, our eyes. Vision loss. High blood pressure can strain or damage blood vessels in the eyes. We know that there's all different sizes of blood vessels throughout our whole body, but the small blood vessels in our eyes are unfortunately often a place where we can see damage due to high blood pressure. Sexual dysfunction. High blood pressure can lead to erectile dysfunction in men or lower libido in women. Angina or chest pain. Over time, high blood pressure can lead to heart disease or microvascular disease. Angina or chest pain is a common symptom of that. And then peripheral artery disease, again, talking about those arteries further out from the heart. Atherosclerosis caused by high blood pressure can cause a narrowing of arteries in the legs, arms, stomach, and head, which can cause pain, and it can also cause fatigue. A lot of times we'll see some symptoms of peripheral artery disease be like an intermittent claudication where you can walk for a certain period of time and then the system gets overwhelmed and you get pain and restriction in the legs because they're not getting enough blood. You sit down and it goes away because we've taken that increased load off of the system. So those are just some examples of how else we can see effects from high blood pressure. There is a handout for your reference that does go through all those things we just talked about, but it's a nice little graphic because it gives you those specific places in the body where we also see some of those effects. We talked about what high blood pressure is. We talked about those numbers and what they mean. So now and we talked about some of the complications, some of the things that we don't want to have happen because of that high blood pressure. So let's now talk about what we can do about it. Changes you can make to manage high blood pressure. So we want to fight back against this silent killer. High blood pressure is a symptomless silent killer that quietly damages blood vessels and leads to serious health problems as well. While there is no cure, using medications as prescribed by your doctor and making recommended lifestyle changes, again, consulting with your doctor would be the best way to talk about those, but we'll give you some examples, can enhance your quality of life and reduce your risk of heart disease, stroke, kidney disease, and many more, such as the things we talked about. So the first thing that's important is to know your numbers. That's why we have that chart provided, and if you went online and looked, there's a million different ways to lay out a chart to track your blood pressures, but just something so that you're aware of it on a little better level than you are now. Or if you're already tracking, keep doing what you're doing because it needs to be personalized, because the only way you're going to keep up with it is if you're using some kind of a tracking log that makes sense for you. So is your blood pressure in a healthy or an unhealthy range generally? The best way to know is to get your blood pressure checked. If you are diagnosed with high blood pressure, you should monitor your blood pressure regularly. Your doctor can suggest exactly how often they'd like you to measure it. Maintaining an awareness of your numbers can alert you to any changes and can help you to detect patterns. Like I said, sometimes we do have fluctuations in our blood pressure, and we will have fluctuations when we're doing more activity. Sometimes we'll have fluctuations with our eating patterns, but the only way you're going to know that is if you're tracking. So tracking your results over time will also reveal if the changes you've made are working. So as I mentioned in the handout, there's that printable blood pressure log to track your blood pressure over time. And then you can reference the chart that had the healthy and unhealthy ranges for your blood pressure to see where things are. And again, unless you're in that bottom category of hypertensive crisis, you shouldn't get super concerned about a little bit of elevation here and there, especially if it's something that you're already talking to your doctor about. Okay, so here are some of those changes that we can make. Eating a well-balanced diet that's low in salt, because we do know that salt does raise our blood pressure. Limiting alcohol. Enjoying regular physical activity. Again, that's one place that I come in. Consult your doctor about what might be a good level of physical activity for you to start with. And if you need help in determining exactly what you should be doing, check in with Wellness or myself, and we can get you going on something that's appropriate for you at this time. Managing your stress. We do have substantial research that stress increases your blood pressure. Maintaining a healthy weight. And if you're smoking, stop. So we'll talk just a little bit about a healthy diet. If you're interested in more information on that, again, Wellness and myself have resources that we can help to talk about nutrition. But we want to eat a healthy diet because it's important for managing your blood pressure and reducing your risk of heart attack, stroke, and other health threats. We want to get quality nutrition from healthy food sources. You want to aim to have a diet that's rich in fruits, vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, and non-tropical vegetable oils. The foods you want to limit are saturated in trans fats, sodium, red meat. If you do eat red meat, you want to compare labels and select the leanest cuts available because it's mostly about that fat content. And then sweets and sugar-sweetened beverages. So this slide says, shaking the salt habit to lower high blood pressure. Many Americans have acquired a taste for a high salt diet. One way to cut back is to skip table salt. Stop adding it in where it's not necessary. However, most of the sodium in our diets does come from packaged processed foods. Eating these foods less often can help to reduce your sodium intake, lower your blood pressure, and or prevent high blood pressure from developing in the first place. I know, especially this time of the year, one of those quick, easy things that I will sometimes do for dinner is just a can of soup, right? But if you've ever looked at the sodium content in a can of soup, you probably fell over. It's a lot, but one good thing is they are offering lower sodium options. So you want to make sure that if you're going with something like soup is just a really great example because it's convenient and it's one place where there is a lot of sodium. There always is going to be a lower sodium option, and so I challenge you to take that option when you can. Personally, I've found that you don't usually sacrifice too much in the way of flavor and taste. There's a lot of really good lower sodium options out there. So be mindful of that as you're choosing what you put in your body. The American Heart Association recommends no more than 2,300 milligrams a day and an ideal limit of no more than 1,500 milligrams per day for most adults, especially for those who already have high blood pressure. Even cutting back by 1,000 milligrams a day can improve blood pressure and heart health. So that's something to really think about because a lot of times we go through and we don't even think about the things that we're picking, but if you can reduce that salt intake, it can make a big difference. And overall, your diet will be healthier if you're choosing things that are less processed, which is where a lot of that salt comes in. Okay, here are some specific examples of some of those sodium sources. Sodium can be sneaky. We want to take control of your sodium by checking labels and reducing preservatives, which is a good thing to follow as a basic guideline for food anyway. Specific foods to be aware of can include processed foods, natural foods with higher than average sodium content, like cheese, seafood, olives, and some legumes, and then table salt, sea salt, and kosher salt. Some over-the-counter drugs also actually do have sodium in them, and then some prescription medications. So again, those last two, that's something that you would need to talk to your doctor about and be weighing the risks and benefits of that with them. So the chart there, again, that print is a little bit small there. But if we look at that largest category, it's processed and restaurant foods is 77% of where we find sodium. Home cooking, 5%. Adding while eating, 6%. And naturally occurring, 12%. So just trying to be aware of that is very important. All right, hopefully we don't have to talk about this too much, but limiting your alcohol does also help to manage high blood pressure. Drinking too much alcohol can raise your blood pressure. If you've been diagnosed with high blood pressure, your doctor may actually advise you to reduce the amount of alcohol you drink. If you do drink, limit your alcohol consumption. For men, no more than 2 drinks per day. Women, no more than 1 drink per day. Again, that has to do with the way we metabolize it. A drink is 1 12-ounce beer, 4 ounces of wine, or 1.5 ounces of 80 proof spirits, or 1 ounce of 100 proof. Hopefully we don't have to spend too much time there, but something to mention, right? Okay. the part where I really come in, getting active to control your high blood pressure. Physical activity not only helps control high blood pressure, but it also helps with another factor, which is helping to manage your weight. And then strengthening your heart and lowering your stress level, okay? So it's checking off lots of boxes on that list of things that we can do to help reduce our blood pressure. A healthy weight, a strong heart, and general emotional health are all good for your blood pressure. This gives a good example. It says exercising 10 minutes at a time, 3 times a day, 5 days a week can lower your blood pressure. That's all you would need to do. I know I've talked to a lot of you that I've seen professionally about doing our exercise frequently in short bursts and not trying to, go for that one walk and poop ourselves out and not do anything else the rest of the day. And this is exactly that, because we're conditioning the body by saying, okay, if we do that 10 minutes of activity 3 times a day, at least 5 days a week, that's telling our body, hey, 3 times today, you're gonna do some physical activity that's gonna get us conditioned to check all those boxes, keep a healthy weight, strong heart. And we do know from lots of research that emotional well-being is also positively impacted by our physical health as well. Okay, so for overall health benefits to the heart, lungs, and circulation, you want to get regular aerobic activity using the following guidelines. For most healthy people, we want to get the equivalent of at least 150 minutes, so 2.5 hours, per week of moderate intensity physical activity, such as brisk walking, okay? Remembering that we always need to gauge that for what we're able to do, right? And we never start right at a point where we're not ready for that. And if brisk walking sounds like something that you're not up for, okay, then you walk at the pace that's comfortable for you, because that's still giving you benefit, okay? So you can break up your weekly physical activity goal however you like, but an easy plan to remember is 30 minutes a day on at least 5 days a week. But like we talked about with the 10-minute sessions, shorter sessions do count as well. Physical activity should be spread throughout the week. It should include flexibility and stretching exercises as well. And then we want to include muscle strengthening activities on at least 2 days of the week. So again, your wellness team and myself are great resources for how to incorporate those things and how to make sure we're checking all those boxes, getting a nice, well-rounded amount of physical activity. Because we do often say that walking is a great way to stay fit. But if you're just doing that, that might not be enough to check all those boxes. Okay, managing stress is also very important to control high blood pressure. In today's fast-paced world filled with increasing demands, stress management is a life skill and a lifesaver. It's also important to note that while the link between stress and high blood pressure is still being studied, stress is known to contribute to risk factors like a poor diet and excessive alcohol consumption. Because if we're not managing that stress, we may be doing other things to try to manage it. So this little graphic up here gives us a little bit of insight into actually what's happening in the body when we undergo stress. So stress activates that fight or flight mechanism within our brain, specifically in the hypothalamus. And then that signals our adrenal glands. And our adrenal glands, the main things that they're known for is that output of adrenaline and cortisol. Okay, not specifically from them, but they release hormone mediators that then cause the release of those substances. That part's not important. But they cause the release of adrenaline and cortisol. Cortisol increases your blood sugar, because if you're in that flight or flight response, you need your blood sugar to be higher so that your muscles have that energy from that sugar in your blood to be able to use and be active. And then adrenaline, of course, we know increases our blood pressure and our heart rate, again, for that fight or flight response to be able to take off quickly and get away from the stressful situation. So if we manage our stress, we can lower our blood pressure. Some of the more specific ways that stress affects your health, like we said, it increases our heart rate and blood pressure to supply blood more quickly and efficiently because it thinks our system needs it. But when it doesn't need it and it is supplied, that's leading to just more stress on the system that we didn't need. In addition to the emotional discomfort we feel when faced with stressful situations, our bodies react by releasing stress hormones, adrenaline and cortisol, into the blood. And these hormones prepare the body for the fight or flight response by making the heart beat faster and constricting the blood vessels to get more blood to the core of the body instead of the extremities. And if we're constricting those blood vessels, that blood pressure is going up. That's what I just said. Constriction of blood vessels and increase in heart rate does raise the blood pressure. But again, that stress is only increasing it temporarily. This is called situational stress, and its effects are generally short-lived and disappear when the stressful event is over. But if we're under chronic or constant stress, that causes our body to go into higher gear on and off for days or weeks at a time. The links between chronic stress and blood pressure are not clear and are still being studied, but we already have data that says it affects our whole system negatively. Okay, so managing our weight to control high blood pressure. A few great reasons to managing your weight. Being overweight puts you at greater risk of developing many health problems. A little weight loss can bring a lot of health gains. Even a small weight loss of, say, 10 pounds can help to manage or prevent high blood pressure. Being overweight puts extra strain on your heart. As we all know, if we've put on a couple extra pounds at different times in our lives, you feel like everything is harder to do. And that's true because your body is having to work harder. So being overweight puts extra strain on your heart, increasing the risk for developing high blood pressure and damage to your blood vessels that can lead to serious health threats. Weight loss reduces the strain on your heart. The two essentials to maintaining a healthy weight are eating well and moving often, right? We manage what we put in, and then we help to offset some of that by continuing to move. If you need to lose weight, you'll need to talk to your healthcare professional about healthy approaches to do that. For example, your doctor may help you figure out how many calories you need for weight loss and advise you on which types of activities are best on that activity side as well. Again, first step is talking to your doctor, your medical professional, but Wellness and I are available for help with that as well. Okay, well, again, just go over this one real quickly. Smoking, high blood pressure, and your health. While smoking is a proven risk factor for heart attack and stroke, its connection to high blood pressure is still being determined. However, both smoking and exposure to secondhand smoke do increase the risk for buildup of fatty substances, plaque, inside the arteries, which is known as atherosclerosis. Say that 3 times fast. A process that high blood pressure is known to accelerate. So if we already have some of that atherosclerosis going on, and then we have high blood pressure continuing to cause damage to the walls of the vessels, it's only going to increase that process. Every time you smoke, it also causes a temporary increase in blood pressure. Smoking is the most important preventable cause of premature death in the United States. Still, that's unfortunate with as much as we know, right? For your overall health and to reduce your risk of heart attack and stroke, avoid all forms of tobacco as well as secondhand smoke. Managing blood pressure is a lifelong commitment. It's not something that we just think about once and then we fix it. No, I wish. If you have high blood pressure, it's vital that you listen to your doctor. Remember, you're a part of your healthcare team, and you and your doctor are partners. You need to educate yourself about high blood pressure and learn how to monitor your blood pressure at home. So there is a handout on vital signs. That's the last one that we didn't go over yet. And that one does talk about how you can monitor your key vital signs and using a blood pressure machine to take your blood pressure. Okay. Also goes over helpful tips of positioning to be in when you're doing that. Because as we talked about, there are those automatic machines and they're so helpful. But your reading is going to be more accurate if you follow some of the tips on that vital signs handout. Okay. The benefits of blood pressure control: lowering the U.S. population's average systolic blood pressure, the top number, by 12 to 13 millimeters of mercury, could reduce stroke by 37%, coronary artery disease by 21%, deaths from cardiovascular disease by 25%, and deaths from all causes by 13%. Only about half of people with high blood pressure have their condition under control. About 53% do, 47% don't. And the source for that is the Centers for Disease Control and Prevention. Now we're armed with this information and we can commit to living heart healthy and managing our blood pressure. Thank you.